Hello, I'm Joan Justice with HealthWorks Collective, and I'm here today with Dr. Akash Rajpal from Mumbai, India. Dr. Rajpal has background in medicine, public health, information technology, and business development, and he's also the founder and the CEO of Ekohealth. Ekohealth is a new organization in India that helps its members negotiate prices and provider availability within the Indian healthcare system. EcoHealth helps patients understand the pricing of surgical procedures and also offers them information on lower-priced generic medications. I asked Akash to talk with us today because some of the issues in India and the United States are similar. The lack of pricing standardization and visibility cause a great deal of confusion for everyone, and any way of making the information more clear would greatly help. It seems that EcoHealth is trying to do this. Akash, tell us a little bit about EcoHealth.
Hey, thanks for having me there. I was there in the San Francisco NASA Singularity University for 3 months because I won this award for the initiative which I'm doing here, which I'm going to talk about. So I saw a lot of problems which were very similar there. The HMOs trying to negotiate pricing and the Obama government trying to reduce the healthcare costs. And here again, though we don't have insurance, our problems are similar, which is there in the United States where they have insurance. So I was trying to figure out why this problem is there. So I realized that the biggest problem is lack of cost standardization. In the United States, there is a lack of cost standardization. Same thing can cost from $70 to $700. I wonder why. Same thing here. For the same surgery or same medicine, something which can cost $100 can also cost you $1,000.
Right.
It's not that the doctors are different, or it's not that the infrastructure is vastly different. The skill sets are similar. It's just that when people are not aware of cost standardization, exploitation happens. And that is what we are trying to reduce. So what happens is that we have the data from insurance payouts, and we have this data of how much people are spending on various surgeries. We collate that and we tell the patient who's associated with us that in case you're going for a particular surgery, this is an average price you should be expecting to pay. And if you're going to pay more than this, you better ask questions. And if you get a price much lesser than that, you should feel happy. And if you're just very sure that the quality of the hospital, etc., is good, then you should immediately go ahead and get the surgery done there. So what happens is typically a patient, be it whether it is in North America or whether it is in India, they're a little scared to talk to doctors on comparison and asking them why they are charging them a particular amount, and they don't even do a research in a typical sense, like they would do a research even while buying a small television set on features and pricing and which is offering a better discount, etc. I wonder why patients don't do that for their own health. So these guys are scared to ask this question. So there is a real life incident here where we helped the patient save a lot of money, which also got published in a leading newspaper here, that this patient was admitted for cardiac arrest and an angioplasty in an emergency, and that patient was made to pay 3 times more. But this patient turned out to be our member, and when he was told that the average pricing is 3 times lesser, and we gave him the bills or the estimates in writing from similar hospitals, so there was an apple-to-apple comparison, and when the patient went to the billing department of their hospital, they didn't know what to do. They actually reduced the entire pricing, and the patient saved a lot of money.
Yeah.
This got published in newspaper.
Yeah.
So this reason I realize is why patients don't communicate too much with the doctor, because they feel that they are not experts at that decision-making process, and the doctor knows the best. I can agree on the clinical decision-making aspect, but I actually don't buy that for cost decision-making process. It is patient's right to inquire what is being spent on his body and why it is being charged in that amount, and he should ask questions. And we believe that over a period of time, when the standardization in cost and publication of these cost averages are mentioned on our site and our members keep on calling us to know how much they should be paying, hospitals won't have that thing or guts to charge a patient more. There won't be any exploitation left. I personally feel it is so simple to solve your problem in the United States because most of your people are insured. You list 50 essential things which is essential for a patient's health, which could be X-rays, CT scans, doctor visits, cardiac bypass, blah blah blah. And you say that this is the rate which we have fixed. No matter whether you're poor or rich, you won't pay more than this amount, and insurance won't pay more than this amount. HMOs actually try and do that, but it actually does not go to the patient. It does not translate into a reduced premium. It does not translate into the reduced payout for their insurance money. It does not happen that way. So that is so simple to do. I wonder why it can't happen there. Same thing with transport is that we're trying to tell the government that okay, these are the list of essential healthcare aspects. You put a cap on that.
Yeah.
And I'll give you a positive example. There are many for-profit hospitals with world-renowned surgeons who are doing cardiac bypass surgeries as low as $500 to $1,000.
That's low.
And they are 365 days, 24 hours fully occupied. They have created a system of domestic medical tourism because the pricing is so low. They don't need any patients from North America now. They have patients from the next neighboring city or the next neighboring state or county. When these patients through word of mouth realize that there is this world-class hospital who's offering, and as an example, just a cardiac bypass surgery at that low rate, they would go there and they make profit. And the patients are happy, insurance is happy because they have to pay less.
Sure.
The hospital, but they're always full. It's just a simple model.
That's right. No, that's it. It's a great idea, and you're acting as advocates for patients and also encouraging patients to ask the price. I mean, that's step one, to ask the price and hopefully get the hospital to come down in the price. That's wonderful.
So now, over a period of time, we have more than 2,500 medical centers as part of the network who are willing to offer discounts, negotiations, some free services to these patients. Obviously, their interest is their productivity should go up without paying any referral fees. If you're aware of how the referral fee system happens in India, which I won't bar that it doesn't happen in the United States, though people may not be aware of, but in India, fee as high as 50% of the patient's bill is paid by many doctors and hospitals to a family care physician or a primary care physician to refer a patient to them.
Yes, I don't think we have that here. I'm hoping not. But yes.
It is immoral, it is unethical.
Absolutely.
A lot of unnecessary surgeries or investigations are done just to increase the price so that they earn more because they have to pay to that referring physician. It's becoming so dirty. I want to minimize or eliminate that. So that once a patient who is our member comes to know that there are these 2,500 centers I can go to, I don't need a middleman. All the doctors are there. I go directly. I have a problem, I'll go to one of these centers. So I want my bill, because it is negotiated, there is a discount, I will have to pay lesser. So this is one thing which we are trying to do. The other thing is, you know that the branded generics, depending on who manufactures and how much they can market their drug directly or by indirect means, the margins on the drugs can be as high from 10% to 2,000%. And obviously a doctor would prescribe a more expensive drug because of the favors they would get from the pharma companies. So what we have done is we've launched a simple SMS product, or the patient calls us up giving a list of medications and we say that, okay, you have equally good, same molecule being manufactured by 20 other manufacturers. This is a list of all those 20 manufacturers. The price is 10 times or 20 times cheaper. You will immediately save that money. The medicine is the same. We are not changing your medicine. It is the same. So this way, the patient on a daily basis can reduce their health costs.
Yeah.
So
pricing visibility.
So this is what I say. Yeah.
It's great. Thank you so much for this interview. Perhaps we could use something like EcoHealth here in the United States. I think it's a really great idea. Thank you.
So thank you so much, and thank you for having me there speaking to your North American folks.
Sure.
You